Thank you for the opportunity to appear tonight, and as Dr. Bray has just indicated, my opening statement is on behalf of both of us. So, as way of background, we're academics at the Australian National University, and we've both worked on a major evaluation of new income management in the Northern Territory undertaken between 2010 and 14, and have continued to monitor policy developments and evaluation of income management policies. We have a background in economics and have worked extensively across a range of social policy fields and in quantitative data analysis and evaluation. We have a strong commitment to evidence-based policy. We consider that the evidence to support the proposals in the bill is lacking. In the explanatory statement, two sources are drawn upon to justify the policy: the AREMA valuation and the Goldfields baseline study. It is important to assess the value of these for informing decisions on this policy. The AREMA study, while we can discuss in more detail the many problems with this, it is sufficient in our view simply to note the conclusion of the Auditor General and to quote, "The approach to monitoring and evaluation was inadequate. As a consequence, it is difficult to conclude whether there has been a reduction in social harm and whether the card was a lower cost welfare quarantining approach." The second, the Goldfield study, is at this stage nothing more than a summary of some qualitative interviews undertaken, and in the words of the report, at a time when the card had only been implemented for a few months. It is a study which contains no substantive evidence of outcomes, but rather variously reports views, opinions and perspectives of selected stakeholders and a small number of participants nominated by some of these stakeholders. This is scarcely an evidence base which justifies the proposal. And in submission, we draw not just upon our evaluation of income management in the Northern Territory, but also the work of others, including Deloitte's evaluation of place-based income management. These studies have consistently found that broadly imposed income management has not resulted in improvements, including in terms of reduced substance abuse, more effective financial management, reduced gambling, or outcomes for children. These studies have not rejected the concept of income management as such, but rather have found that these policies, when applied broadly, not only have failed to achieve improved outcomes, but impose costs on individuals and risk increasing dependency, rather than boosting individual capacity and independence. In contrast, along with other research, such as the Cape York trial, they suggest there is some evidence to support a role for tightly and individually targeted use of income management, along with other supports for some individuals who have demonstrated inability to manage, as an option for individuals to choose to use if they're looking for an additional tool to assist them to manage. This differentiation is critical. Our submission has two attachments. One focuses on some of the issues with the two evaluations for the cashless debit card. The other extends some of the analysis presented in our evaluation of new income management to look at contemporary community level outcomes for the Indigenous population in the NT and the impacts of income management. This second paper finds that despite the fact that around 1/3 of Indigenous people aged 15 years and over have been subject to income management for a decade, there have been no significant gains in child wellbeing, education, excessive alcohol consumption or crime. This is further evidence, we believe, of the failure of the mass implementation of this type of program. Finally, in looking at this data, we're aware that some of the statistics we use have been presented to the committee already, including the evidence presented by Professor Silburn on low birth weight. We note Senator Hughes speculated, and I quote from the draft Hansard, "We also don't know if perhaps that low birth weight risk has been mitigated through better nutrition, as young children, perhaps through securing a better diet with more fruits and vegetables, have more basic needs met through the provision of essential services as part of that income-managed quarantined welfare payment." In fact, we know much of the answer to this speculation, and unfortunately it is not positive. The question of changes in consumption associated with the Northern Territory Emergency Response Income Management was looked at by Brindlecombe and others in an article published in the Medical Journal of Australia, and reports, as with tobacco sales, income management had no apparent effect on fruit and vegetable sales. We looked at this question again over the later period of new income management and reported in our evaluation firstly that fruit and vegetable sales were very low, in particular by people on Basics card, and secondly that detailed analysis of sales and communities found there was no positive association between the level of income management and fruit and vegetable sales. We believe that again this highlights the importance of taking an evidence-based approach to this policy. In conclusion, we iterate our view that decisions on this bill should be based upon the evidence, not upon anecdotes, discredited studies or speculation. More so, we consider that the evidence we've presented on outcomes in the Northern Territory calls for real policy response, not the continued implementation of failed programs.